Well, I'm very glad you all came. Yeah, I haven't given a talk in about 10 years. So, some years ago, I heard a lady on public radio, and she was an author. And then, at the end of the talk, the journalist said, "Are you ever nervous when you give a talk to people?" And she said, "I absolutely am, until the subject takes over." Yeah. And I have full confidence that the subject will take over. Yeah. So, I just for the people who don't, I want to just say in a minute or two, I am a Dutchman, yeah, and an American citizen too, by the way. And I came to the United States to do a residency in internal medicine. That's what I ended up becoming. And once I was in working as an internist, very quickly I realized that the majority of people had not the illnesses that I was trained in. You get trained in cancer and heart disease, and the majority of people that come to an internist, they're tired and they're, they can't sleep and they're depressed and they have stomach problems and they're hurting, and then you do all the tests in the book and you can't find anything wrong. But luckily, there are pain pills, sleeping pills, antidepressants, and that's what. And then in the system, when somebody has a real illness, you have to refer them. And so I got very quickly frustrated with that, and I started, wondering about vitamins and natural things. And at that time, I didn't know really where to go, and I ended up actually learning initially from chiropractors, because this was in 1993. And so, I started learning a lot, and very quickly, within probably half a year, I started applying some of these things, and it really seemed to help people. But within that medical group, it was just a matter of time, and it would become, was obvious that I was working with nutrients, and it became really very difficult to stay there, so I left. And so when I got into this medicine, I didn't know whether there was anything into it, but I thought I'd just move into it, and when there's nothing to it, I go back and I do the other things. And so that's now, almost 32 years ago. We were initially in California, and in 2000, my wife and I, we moved back to Pennsylvania. My wife is originally from Berwick. I met her as a nurse in Presbyterian Hospital in Philadelphia, and we moved more because she was sick, and it turned out she had Lyme disease. We didn't know that, and that's kind of how I got into treating Lyme disease. So I want to talk a little bit about, just a few minutes about, what about the whole body, and then we're going to focus in on more hormones. Yeah. Let's see if I push the right button here. Before that worked that way. There we go. So, what keeps us healthy is our immune system. When we have a healthy immune system, we don't get sick. Yeah, it gives health and vitality. And I always say there are two categories why we're not well, gross categories. Well, one, something is nagging the body, preventing it from getting well. Chemicals, toxins, excessive stress, infections, whatever that is. Lots of things put constant stress on the body. And so that is my experience when you deal with chronic illness. It's never caused by one thing. It's always caused by multiple things. I know there are a whole bunch of nurses here. You know that in conventional medicine, we're also looking for the cause. Well, the cause doesn't exist because there are many causes. And so in the system, there's often no way of looking at that. And then the other thing is, well, are we lacking? Is that body, the totality of it, able to, does it have enough things to deal with the stresses that come on the other side? Yeah? And so there's a lot of things that affect our immune system. Diet does, heavy metals, chemicals, toxins, stress, injuries, allergies, social and spiritual issues, genetics, structural things, digestion, and all these things, exercise or the lack thereof. And then today we're going to talk about hormonal balance. Yeah, what about our hormonal system? And our hormones are. Hormone system is a communication system. It sends messages. There are feedback mechanisms, and it has to do with our vitality and our energy. both in men and women, and many women, have a lot of symptoms that could be related to hormones, fatigue and mood swings, tension, lack of sleep, memory, decreased sex drive, depression, hot flashes, etc. Recently I learned that to my daughter, we used to call it PMS, but now there's a new name for it. When you have real bad PMS, they call it premenstrual dysphoric disorder. And that's reason to give an antidepressant, I always say. So, and for the guys, it's, very similar symptoms: sleep loss, joint aches, headaches, fatigue, depression, various things that some are similar and some, of course, they're more typical for men. So the question is then, are these due to hormonal imbalance? And so, I do work many times. Hormones are an issue. And, there are many ways doctors give hormones, and there are two kinds: of synthetic hormones and they're bioidentical hormones. And people always say, well, are bioidentical hormones natural? Well, even the bioidentical, or what we call natural hormones, they're made by pharmaceutical industry. We don't find estrogen, testosterone, or progesterone in a plant, and we don't get it from animals. Of course, there was, for a while there, we used to get estrogen from horses, from Premarin is from pregnant mare urine. And, so the thing is, the hormones we use are hormones that the same way the body makes them. So you have to figure out, do you have enough, and have you run out? Is there a lack? And then, we can work with that. And so we work with the hormone levels. And, but sometimes people come in and they think they have hormone imbalances. And then, I don't think they are. Because what I found over the years, that there's a lot of other things that can affect that. I remember when I started first working with bioidentical hormones, this was in '94, and I was in Sacramento, and this woman had come down from Chico, which is about a 2-hour drive, and I always say, I remember her, that she had the personality of the queen in Alice of Wonderland, very intense, and she was having hot flashes, 20, 30 a day. And she had tried Premarin and Provera, and it hadn't helped. And so I was the person who was supposed to save her. And I remember thinking, if Premarin and Provera doesn't get to talk my hot flash away, I'm not sure I can. But she had a lot of digestive problems. And in those days, nobody checked hormone levels. You were a woman going into change, you got hormones. And so I said, well, why don't we check some hormones? And in the meantime, I give you this diet and a few herbs for your digestive tract. And then she came back a few weeks later, and she lost 10 pounds, and she had only 2 or 3 hot flashes anymore. And I thought, well, I was surprised. I said, well, what it has to do with it? And, but later on over the years, now we know way more about what we call the microbiome than we did then. But I came across a couple of papers that indicated that certain bacteria in our gut could interfere with the absorption of phytohormones. There are hormone-like substances in our food. We're all familiar with soy that might have a little estrogenic effect, certain substances in that. And there are also certain bacteria that can make an enzyme called glucuronase, because one way the body detoxifies hormones is by excreting them, by hooking them onto glucuronic acid in the liver, and then they get excreted. Well, when you have glucuronase, it uncouples them, and so you get fluctuations in the hormones. And so that was for me reason enough, wow, if you come in and you want to do something with hormones, you have to make sure your digestive tract is in decent shape. And then sometimes the yeast and bacterial imbalances. The other thing that's really important is your adrenal glands. Yeah, because especially for women, you know, when you get towards menopause and your ovaries start making estrogen, if you have healthy adrenals, they pick up. The adrenals make testosterone, estrogen, progesterone, but not a lot. But when you have healthy adrenals, then, you know, many women that have good healthy adrenals, they kind of breeze through menopause. You know, I remember even that at some point, you know, you would say, well, you know, Japanese women don't have as much trouble with menopause because they eat a lot of soy. And I thought, no, living in the United States is very stressful and your diet is really bad and it drains your adrenals. And in Japan, everything is predictable. You know, the people live predictable lives. So it's not necessarily that, but that living stress can, you know, drain your adrenals, and then they can't pick up that extra estrogen, causing these ups and downs and then having those symptoms. So what I say, you know, you need to clean up your diet, do some exercise, other habits that are just important. And, you know, and sometimes there's certain herbs, you know, like we heard of black cohosh and other herbs that might sometimes help modulate that. You know, and then you can also get other problems that are related to hormones. And, you know, one of them is actually, you know, osteoporosis. You know, I find many, many women who have osteoporosis, they actually have low testosterone. You know, testosterone is an anabolic building hormone. So I've seen over the years, and we're going to go into that a little later. So it's all about keeping everything in balance. You know, and as I've worked with this over the last 25, 30 years, I find that more and more things have come in that we can sometimes make people feel better by being much more subtle, but we have to work on a broader level. So once you say, well, ooh, wow, I might benefit from hormones, what are we going to use? And there's several forms. You know, first, I choose to use bioidentical hormones. Yeah, and later on, I'm going to talk a little bit about the Women's Health Initiative. You know, remember 15 years ago when suddenly it came out that hormones cause breast cancer. Remember that?
Yes.
Yeah, so I'm going to go into that. So, you know, there are various forms. You can take hormones in pills. You know, you can do injections, although for women that really doesn't happen. Men get sometimes testosterone injections. Of course, the depot form, actually what I'm going to talk about is what I use a lot. It is a form of depot, but it's not the same like Depo-Provera, you know, that they used as a contraceptive a long time ago. And then there's more natural forms like patches, creams, and gels. And then there are also the pellets, and then also creams. They're bioidentical. So just a little bit of, you know, why I prefer using one versus the other. Yeah? When we take hormones orally, they have to get absorbed, and then they have to first go to the liver. And the liver does stuff with it. And so when you take estrogen in a tablet or a capsule, then that's much, you know, harder to know what your particular liver is going to do with that. You know, and depending on whether the hormones are bioidentical or not, then it could also cause issues with, you know, the breast can be affected different. You could get vaginal bleeding. Sometimes you hear that people have heightened blood clots. Sometimes you see that in certain birth controls that have a combination of synthetic progestins and also usually it's ethinyl estradiol and norepinephrine. Those are kind of hormones that are in birth control pills, and they can cause trouble. So patches give you a little bit more even levels, yeah, because they're on all the time. And they also bypass the liver, yeah, so you don't have that. But it's a matter, you have to have a patch on. The patch might lose when you shower, etc. and you need to keep changing them. You know, creams, you have to kind of, you know, rub them on twice a day. And often you get the creams only from compounding pharmacies, because usually commercial pharmacies, except for vaginal cream, they don't have creams that you use otherwise transdermal. And then the pellets, you know, the pellets have been around for a long, long time. I started working them about 20 years ago. I learned about them. And, you know, at that time, I was together in an office with another doctor who had started doing that, and I learned about it. And we were basically the only person in the whole wider Philadelphia area that did that. I remember having a lady flew down from Boston every 6 months to get these pellets. Now there are actually a lot of places where you can get them. And I comment on that because later on I'll get into that. You know, this is some literature about that, and you know, the nice thing when you use pellets, you use dramatically less estrogen and testosterone than when you use creams or pills. First, the creams don't get absorbed all the time. The one thing that, you know, depending on whether you still have a uterus, you need to take progesterone when you take estrogen, because when you take unopposed estrogen, you have a somewhat increased tendency to get uterine cancer. Good. You know, so again, I like the pellets, you know. I've given my wife pellets. I'll cut that out of the tape later on. My wife doesn't want me to talk about her. And I do pellets myself, you know. Men can get hormone pellets too. Actually, I got some last Saturday. You know, the nice thing about pellets is that you put the pellet in and it lasts 4 to 6 months. You know, and later on I have some samples, I have you, you know, see what they look like. You know, it's actually interesting what I find, because I use often testosterone for osteoporosis. And I've had over the years when I've had women use creams, somehow that doesn't increase the bone density as much as we do a pellet. And you actually use way less testosterone, and I think it's because the level is more even. You know, you have that pellet and it's much more even than when you rub creams on. When you rub creams on, it goes up and then it goes down. So the pellet, we do that. It's a really tightly compressed either estrogen or testosterone, and it can last 4 to 6 months. Doesn't pass to the liver because it comes from the fatty tissue. You know, basically the way we do that, it's a sterile procedure. We numb it up, we make a little cut, and we put with a probe the pellet right into the fatty tissue. And then, you know, you can for a couple of days not swim or bathe and not exercise, but it just heals up. Yeah. So this is just how we would set that up, you know, when people want to do that. And, you know, and then we do the insertion after we got some labs done and we have results back. The way you monitor it is by using labs, especially the first time. I always check labs after that and see what your levels are. And, you know, but usually in a repeated thing, I don't even check levels every time anymore, because for every person, you kind of get an idea of how they do with that, yeah. It's actually interesting. What I see is that some patients, these things wear out, and it just slowly, they're not even aware, they start feeling, you know, worse. And there's some women, they go to bed and they're fine, and they wake up the next day and they said, oh, my pellet is gone. And they call up and say, my pellet is worn out. Yeah. They dissolve into nothing, by the way. You know, we do get DEXA scans, and you know, it's kind of interesting. Actually, I have one lady who is now 80. I saw her this week, and in 2016, she had osteoporosis. I think her T-score was minus 2.8 in her spine, and we did pellets every 6 months, and we gave her, magnesium, calcium, boron, nutrients for the bones too, and slowly, and 2 years ago, her bone density, her T-score was minus 0.8, basically identical in a 28-year-old. And I saw her again this week, and it's still good. It's really interesting. So then I want to talk a little bit about, has anybody of you thinks that estrogen itself causes breast cancer? Any of you think that anymore? Not really? Because, I see still that women come from gynecologists and they say, oh, no, you can't do estrogen. It could aggravate breast cancer. Now, I have to say, when you have a mother who had breast cancer, estrogen positive, and an aunt and a sister, well, then you don't want to do that. But in general, not. And so the main study that was done probably about 15 or 20 years ago was the Women's Health Initiative. And this study was designed basically to prove that every woman needs hormones and that it's good for them. And so in that group, they gave women Premarin, which is made from horse urine, and a progesterone, medroxyprogesterone, or Provera. Now, in that, remember when that study came out, suddenly it was all over the news. Hormones cause breast cancer. And I remember looking at that study, and I thought, it's not the estrogen, it's the medroxyprogesterone. And because they had 3 groups of women in that study. First, the average age of women was 62 starting hormones. And those were women who never had hormones before, so they had been in menopause for quite a while. And so the group of women that still had a uterus, they gave Premarin and then the medroxyprogesterone to lower the risk of uterine cancer. Then they had also a large group of women that had had a hysterectomy. Well, they can't get uterine cancer, so they gave only Premarin, and then they had a control group. And it turned out that the group of women that got the Premarin and the Provera had a marked increase in breast cancer. This came out in the media, and the whole thing was stopped. I mean, I remember at that time seeing women where their doctors just stopped their hormone replacement. And they would get hot flashes and all that. And so, but it turned out that the group of women that got only the Premarin, they had actually a slightly lower rate of breast cancer than the women that were in the placebo group. But it wasn't statistically significant. So when they looked at this, so this here during this is actually the text of the people that did the study, but 12 years later. And they found that the estrogen plus progestin trial, the breast cancer risk was about 24% increased. So for every 10,000 women taking that, there were 9 extra cases. And I want to a little bit talk about, when statistics come out and they scare everybody, and I'm not saying this is not good, but when you look at if there were 9 extra cases for every 10,000 women and 24% more, that means there were 36 without it and 45 before. It's of 10,000 women. So it's not like every woman gets breast cancer. It is very interesting because you have to always ask when risks get, on the news or doctors say that whether they talk about absolute risk or relative risk. Yeah, you're familiar with these terms or not? Anybody wants me to explain that? Yeah, okay. So what they found, so there were 9 extra cases, and that the extra breast cancer continued for 12 years after they stopped them. Now, in the estrogen alone trial, they found actually a reduced risk of breast cancer, and they found for every 10,000 women taking estrogen alone, there were several fewer cases. And that continued, so it reduced the breast cancer by 21% over 13 years. So what that means is that actually the estrogen had a protective effect. And I remember hearing one of the doctors from the study saying that they estimated that 12 years later that 35,000 women died prematurely from breast cancer because they were not given estrogen. I mean, that is amazing. But it doesn't matter. This was out, and I still sometimes hear older gynecologists saying, it causes breast cancer. Now, this is an interesting paper that came out of France where they looked at 80,000 postmenopausal women over 8 years for each average. And they had 2,300 cases of invasive breast cancer. And so the women that never had hormones, they gave a relative risk of 1. And it turns out that the women that got estrogen and progesterone, bioidentical, also had a relative risk of 1. It varied a little bit. But the women that got estrogen and dydrogesterone, which is synthetic, had a slightly increase. And women that took other prostogens, it was almost double. And it was the medroxyprogesterone, the synthetic hormone. Another thing that can affect your hormone is all the chemicals we have in our environment. You're probably familiar with some of them: herbicides, plastics, dioxin, fire retardants. Recently I saw again something that's in children's clothing and sleepwear and mattresses. Lead, arsenic, mercury, all these various things. In one way, when you look at it, it's kind of overwhelming. And I see that sometimes when patients come to me, and you start talking too much about all these things, it's so overwhelming. People can't handle it. And the advice that I give is you learn a little, you change a little. You learn a little, you change a little. So you learn about a different detergent that has less chemicals in it, so you take that. And soap, and how what you use for pesticides and the foods you choose. I'm really excited that Robert Kennedy is bringing more awareness to all the chemicals and toxins in our food. My wife and I, we were, in the fall, we were in Montreal. And there's just hardly any overweight people on the street. It's really amazing. But you buy M&Ms in Montreal and they're just a little paler than in the United States because they put more natural food coloring in it rather than the chemicals. So this is a study with osteoporosis where they found an increase in bone density, mainly with testosterone. See, it was the most with pellet. Patches were less and oral estrogens less. This is kind of the different forms of estrogen. I do use creams. I never use Premarin. But when you look in the creams, when you give somebody twice daily an estrogen cream over 6 months, depending on how much you give, you give about 45 to 90 milligrams of estrogen. But when you give the pellet, you give only 6 or 12 and a half, much less. And and it's not a matter of getting hormones high. It's more that you prevent the ups and downs. And I remember, when my wife started having some ups and downs, even when she still had periods, I just gave her a teeny bit. And I just ate the dips out, and suddenly the symptoms, they didn't really occur. This is the doctor that trained me, actually, Dr. Tutera, who's a gynecologist in Arizona. He looked at the women that had come to him, almost 1,000. They had only 1 case of breast cancer, so that, of course, it's not an official starting study, but it's interesting data. The advantages of the pellets are that, you get nice even levels, it's steady, you don't get ups and downs, you don't need to rub creams on or take pills, and it's the best way to increase bone density. And, we have to insert it. It's very easy to do. I do have a nurse in the other office who has done this for 20 years also. Stephanie will do that soon too. It's very easy to do. And so now I want to talk about oxytocin. That's my latest exciting thing. Anybody not know what oxytocin is?
I never heard the term.
Okay. So, Have you ever heard that women, when they go into labor and they need to speed it up, they get a Pitocin drip?
Yeah.
That is oxytocin. So oxytocin is called the love hormone. Yeah? It's made in the hypothalamus, gets excreted to the pituitary, but it goes to every part of your brain and into your body, and it affects bonding. But it turns out it's a very a hormone slash neurotransmitter with many different effects. You can just go online and Google oxytocin and chronic pain, oxytocin fibromyalgia, oxytocin migraine headaches, oxytocin osteoporosis, surprised at that, MS, autoimmune disease, sleep, anxiety. It just goes on and on and on. The problem is that oxytocin commercially has only been available in either an injection or an IV. But there's some compounding pharmacies that have been able to make it into a tablet. And it's very easy to take. So I have to say that in the last 4 or 5 months, I've probably written 250 prescriptions for this. And I've had, men and women have equal amounts of oxytocin. And I've really seen, there are a bunch of people that say, I took it, I didn't feel any difference, because there's really no odd side effects to it. But very exciting. I think it's a missing piece in the whole, I call it the hormonal orchestra. Yeah, estrogen is an instrument, progesterone is, testosterone, thyroid, adrenal, and suddenly we've left a few instruments out. So that's really an exciting thing. And actually, you all got a questionnaire. The way I base that, whether we give that, is based on these questionnaires. If you have a low score, these questionnaires were developed by a guy, Thierry Hertoger. He's a Belgian endocrinologist from a long family of endocrinologists. I mean, he's famous in the integrative world. He's written many books. So he developed this questionnaire because it's really hard to measure. You can't just send a script for an oxytocin level to LabCorp Quest. So I based that mainly on these questionnaires, And, so it really does a lot of things: sleep, anxiety, depression, pain, irritable bowel, migraine. It's really I'm really very excited by that. And I actually think that as I'm going along, that we're going to find out that when you do that too, that you suddenly need much less of even estrogen or testosterone. There is an interesting concept it's called the concept of hormesis. And hormesis means that you get the maximum effect with the least intervention. Yeah, so you do a little thing, and it has an amazing effect. And often, when you deal with any chronic symptoms, that it's a matter to find out which things we have to work on. You don't always have to work on everything, but you have to just hit the right things. What I have seen over the last 10 years, until about 10 years ago, I mean, there were maybe 3 people in the whole Philadelphia area that did pellets. And now they're everywhere. I mean, not everywhere, but there's many, many places. And many of them are the companies that make that. They go and they train doctors, and they have basically people on an every 3 months protocol. And I've seen several patients come to me, and I check the testosterone, and women's testosterone is almost like the low level of a male, because they just get these pellets. And the first 2 times they feel a lot better, but the 3rd time they don't, because you don't look at the adrenals and the thyroid and the digestive tract. Not that everybody needs to, but when it's an issue, you have to. And I find this actually may be even another fairly easy part to try and see if you do better. And so that's what I just said, the questionnaires, and it's available from a compounding pharmacy. So we do blood testing prior, and even when you want to use creams, I'm not forcing anybody to do pellets, it's not that. We check testosterone, free and total, thyroid, PSA for men, estrogen, FSH, and then I'm really big on saliva cortisol test. Yeah? Because I find blood cortisol is only low when you have very severe deficiency. So the blood test usually is normal, and then when you do a saliva test, it shows low. And that's what you hear. People feel better again. They feel normal. It's actually, I've had that. I've had women bring their husbands, and it's almost like they can't keep up with each other in a way. Yeah. We'll cut that out of the film, put it on my website. And that is, there is 2019, and it was on April 26th. I had my 66th birthday, and I was with my wife. We were in and there's no questions if you have. About anything, by the way. I'm good with. Yes, Rita.
I'm sorry, I didn't mean to talk over
Go
one.
ahead.
I just wondered how you get started.
Well, we have a questionnaire on our website, and you fill the questionnaire out, and then then we call you, and you come in, and then we it depends a little bit. Sometimes a person calls, and I look at the questionnaire, and it's very obvious that the issue is very clear cut. So because when I see people for an hour and 15 minutes, and no, everything is associated with cost, and it is. And so, but on the other hand, when I see that, wow, I need to work with this person adrenals too, because otherwise they're not going to feel optimally. So once we get that, then we'll set up an appointment, and then we take a history, and then we draw some lab tests. And then, usually then you come back, and if we want to do pellets, we do pellets. Yeah? Good. You had Rita?
Yes, I have a comment and then a question. You've been my physician and saved my life. I have adrenal problem, bowel problem, thyroid problem. I was receiving the pellets, and I was telling my friend Karen, it was a life changer. I stopped taking the pellets, and
I'm close by
so
now.
I'm coming to you. And there's, in a couple weeks, we have
Yeah.
an appointment. But my question, when you're talking about endocrine disruptors, I'm pretty sure you're aware of what's in the Berwick area right now. We have PFAS. We're dealing with PFAS. And when you were going through the list of endocrine disruptors, I'm pretty sure PFAS falls into this unfortunate predicament. DEP is working with the residents testing. It's a little illegitimate how they're testing one house versus the other. My concern with all of my medical history is that I may indeed have PFAS, although I've been tested negative out of my hose. My neighbor was tested in her basement. She's got it high, and I have negative. And I think it's a big lie. But you know that I also had the arsenic in my well when I first moved in. This is another endocrine disruptor. I'm nervous about all of this. And do you have any comments to put this to rest, at peace? What are your comments about PFAS?
Well, first, I'm not an expert on any of these detox. I would have to look it up. What would you do to detox? Of course, if you have something in your environment or your water, you want to clean it up. I recommend people that live out somewhere to get a water system. You can get a whole house water system. Usually about $1,800. I got one for $1,400.
I have.
And you put that in, so you want to have clean water. And the environment, if the question is always, where do they come from, all these various materials, and do you have something right in your home? One thing that I see often that makes people very sick, if they have mold and mold toxins. So these particular chemicals, I don't necessarily do specifically anything about that. I would look into it. Does it make sense? If there's a concern about that. And it's very okay to do research and say, well, how do you protect yourself? Because, you can't always say, well, I'm just going to move out. Well, where are you going to move? It's not a simple thing. But there's certain things that you might be able to do for your body to detoxify them. Right. There's certain herbs that detoxify, NAC detoxify, glutathione. But again, I would want to know, you don't want to take all these things. You want to kind of know what's specific to what.
Correct.
Yeah, and that I would have to do research about that.
Do you perform the lab test for the PFAS? I understand that there is a particular lab test that can check your levels.
I would have to check whether I do one test. It's a urine test that measures a lot of chemical metabolites, and I'm not sure that that's one of them. I have to look up that. So when you take a morning urine, and then we send it, and they check for a whole slew of chemical metabolites.
Okay.
Like pesticides and plastics and gasoline and cleaning material metabolites, and a whole slew of them, all in one urine sample.
I was told at the township meeting that it's a very expensive test.
Well, that test costs a couple of $100 when you send it for all these things.
And it's not covered.
Yeah. Unfortunately, a lot of it is not covered.
Right.
It's, saliva testing is not covered. Blood testing is. I do a lot of Lyme testing, and some labs is covered, but the one that I like the most is not covered unless you're on Medicare.
Right.
They do cover that. And so you have to just juggle with it. And I try to be judicial in what I decide, because you can, I remember when my wife was first diagnosed with Lyme disease, we went to this doctor in the tip of Long Island. And, because and he ordered all these scans. And I've been around long enough. And, and we had at that time, whatever, $10,000 deductible insurance. And I remember calling him up. I say, do you really need that? He said, no, it's just nice to know. No. Well, that's not reason enough for me to spend $10,000. And he was okay with not doing it. Of course, first I had to get the permission of my wife because I had not been able to help her. And there she went to a doctor who knew how to treat what she had, and I was there, I didn't want to interfere. Because I was humbled by the fact that I hadn't been able to help her. But, in a certain moment, there's so much money involved. And I tend to be, I've had on occasion in my career where, then I am more cautious, and then, many people you do fine, and then there's this one person, you go back and you order that, and it turns out that was it. It's a dynamic interaction. I always say, when you work with a patient, to me, it's always a dialogue. Yeah. It's never, well, I know what you need, and you just follow what I say. It's a dialogue, and many of these, especially these functional disorders, or when you feel healthy, okay, but you want to feel better, much of it depends on what the person wants. There are things that I could do that would make me feel better that are just not worth the effort to me. That makes sense? It's just me personally. Doesn't make sense? I possibly could do a lot of things, I just can't do it, or I don't want to do it. And that's very important, especially about things that are not, killing you. Does that make sense? Yeah, good.
Thank you.
Yes.
I actually have several questions. Any side effects with the pellets?
In general, not. I haven't seen anything. On rare occasion, when you take a woman who's just had in menopause for 2 years, yeah, and you give them regular pellets, sometimes they get a period again, because estrogen juices up the lining of the uterus, and then it'll come, and so I tell women that. Very rare, maybe 2 or 3 times over the 20 years that I've done it, sometimes you have a woman and they start bleeding and they just won't stop. And they have to go get a D&C. But it happens very rare. But I always tell women, that could theoretically happen. When a woman has been in menopause for 5 years, the lining of the uterus is so shriveled down, there's no life in it anymore, so the estrogen doesn't matter. I've had a couple of women over these 20 years, actually 2, that they had been in menopause for 7, 8 years. I gave them 1 pellet and they started spotting. And it turned out they had endometrial cancer. So the pellet brought it to the light. Does it make sense? Because you don't get any endometrial problems from estrogen on the spot. So it actually was the benefit, it could have taken another 2 years before that would have been manifest. So those are, but, and then what I also sometimes see, that when women in menopause, and they used to have a lot of breast tenderness, premenstrual, I give them less estrogen. Because some women, you give them a pellet and they have breast tenderness for a month. I mean, these things, they don't happen a lot, but they do happen. So I ask that always, that, usually I give either 12 or 6 milligrams. So when a woman comes in and I ask them, did you have a lot of breast tenderness pre-men? So they say, oh yeah, then I just give them 6. And then when that does happen, sometimes iodine and vitamin E and those things, and sometimes a little more progesterone can help alleviate that. Yeah. It's always an interaction with each individual. Yeah.
Secondly, how long does a pellet last?
I would say about 4 to 6 months. See, that is one thing that you see many of these places where I see that, where women are just coming in every 12, 13 weeks. Well, because they want to prevent, where you do this, but I find sometimes what happens is it gets higher. It's really interesting. That's the same thing. I get, many women have, like their testosterone is zilch. Yeah, and testosterone plays a role in the mitochondria. Yeah, when you in the mitochondria, in the Krebs cycle, yeah, the citric acid cycle where the ATP is produced, anabolic hormones play a role in that. Because you say, well, what do you do? What do testosterone do for women? It does the same in men. Energy, stamina, mental clarity, exercise tolerance, libido. The odd thing of it, many people think that in men, that testosterone has a lot to do with libido. I don't agree at all. I see so many guys that have really low testosterone, no trouble with the libido or erection. For guys, it's just a feel-good hormone, and it has to do with energy and stamina. So very interesting. And, and sometimes women are afraid they're going to grow a beard or whatever. And, I sometimes have seen that very rarely, that when you have women they have often a darker complexion, like from more Mediterranean, and they're like, and then they sometimes get a hair, and, it depends all on the woman, you can pull it out, but it's rare. These things happen rarely, and they're not any major. So every 4 to 6 months. But I do find sometimes, as I do more, that, sometimes women go, 7, 8 months and they do fine. And I've had also women, they say, well, I need to come every 4 months. Because they often, we schedule it 5 or 6 months out for another one. And then they say, well, I should have come a month early because I've been having hot flashes or I've been more tired. It's also fascinating that many women, when you give them testosterone, they sleep better. Like I have some women, they come when they can't sleep anymore. They know they need testosterone. Very interesting. The effects of these hormones, there's so much we don't know how they work on a broad level, yeah.
And my last question is it covered by insurance, and if not, how expensive are they?
It's not covered by insurance. Usually the pellet insertion and the pellets for women is around $300. It's probably, if you get creams, it'll be the same, kind of. Now for men, because they get, actually let me have these things go around. Yeah, I would just take them out, Mm-hmm. And I'm sure somebody might drop them and then can't find them. They're so little, With that, make it up. So you can see there's one, a female testosterone that is like a grain of rice. The estrogen is the smallest little thing. I would just get them out. Just take them out, and then Yeah, that's for the male. You can take it and give it on. It's not sterile anymore. So, and so that is about 200 milligrams. So guys get about 6 to 8 of those. So that's a testosterone for men, but they get 6 to 8 of those.
Thinner.
And that's the female, and this is 100 milligrams. I have 187 of 50.
This one is super duper tiny.
Yeah.
Take that one, just take that.
And what makes, because it's what he's.
That's it. That's the estrogen, yeah.
And that last year, that.
And does each one cost a couple $100?
No, the whole thing. But for men, I mean, they get 7, 8. Usually for men, it can be an insertion, can be like $700 because you get that many pellets. But the insertion, we charge $200, and then depending on how much pellets you get.
That's
So,
what I was wondering.
so women only get 2 pellets or 1 pellet. If they only get testosterone, then that's what they get. Because I tend to give women, when they're more around menopause, when women get older, I only give them testosterone. Because if you don't have estrogenic symptoms, I don't see a reason to do that. Yeah.
So do you see when it's wearing off? Is it like the birth control when it's wearing off and women say that they're getting more PMS symptoms?
Well, it's more tired, or they might get hot flashes or not sleeping. I don't see, I mean, if sometimes testosterone in some women, it helps them with their mood. Now only in the last 4 months I've been working with oxytocin, and that is just,
Instead of this?
No, well, I just add it in, and then we'll see how. I really haven't seen yet whether then people need less frequent pellets. But I'm.
Without the pellets.
Well, you could do that too. You could try it. These are not life-saving things, so you can always work with it. Does that make sense? I always find that I need to work with people where they're at. There are a few people, I don't necessarily agree with that. They can only do one thing at a time. Because I need to know whether that works. Well, a biological system is never just one thing at a time.
Right.
But that's just, you have to work with people. And yes,
And I have a question about, suppose, I take a levothyroxine.
yes.
So, I haven't changed the dose since I started it when I was 45, I'll be 57.
Yeah.
I'm on the same dose, I go
You
every
get
year.
it checked and everything?
Yes, yeah, I get my blood work every year. So what, when you treat the thyroid condition, what happens with the medication that you're taking?
Well, I work with other forms of thyroid, like Armour thyroid, NP thyroid, slow release T3, and I've had over the years many, mostly women, sometimes men, they get diagnosed with hypothyroidism, and their numbers, they get put on thyroid, and their TSH comes back within normal range, but they don't feel any better. And so I measure free T4 and free T3, and and we play with that. You have to kind of see.
I was originally diagnosed with Hashimoto's, but how do they know that for sure?
Well, you can do antibody testing. Yeah. Many doctors say, well, it doesn't really matter anyhow, you just need to be treated. And so it varies.
I'll speak to the thyroid part of it as well, because I actually was born hypothyroid. My thyroid never actually started to work. So about 2 weeks, I was 2 weeks old, 2 weeks old. My mom got a phone call from the ER, actually, from the doctor saying I needed to be taken back to the hospital at that point. I think the doctor called her and told her to take me to the hospital because I didn't have any thyroid. So this was definitely not something common because I was born in the 80s, and they just started testing thyroid in birth. And so my mom tells the story about how she had to take me for blood work all the time, but she made my grandmother always take me because she couldn't deal with the crying with getting my blood work done. But then they didn't have any other forms of Synthroid back then other than oral, so she had to crush up my pills, hoping for the best that I was getting the right amount of Synthroid. However, so of course, I've dealt with that my whole entire life. I've always dealt with a hypothyroid. I was on Synthroid forever. My endocrinologist was always like, it has to be brand specific. However, when I was in college time, like my college years, I wasn't good at taking pills at that point, because what college person is, I guess, I don't know, I just didn't want to take pills all the time, but I got really sick, obviously, because I wasn't taking them then. But that was another thing that one of the main reasons why I wanted to go to Dr. Mulders as well was because he treats the whole body. I could have gone and had somebody treat just my Lyme's. I could have gone somewhere else that was just more, general or specific to one area. However, he treated everything. So, yes, he helped me out through the Lyme's part of it, but then once I was better, I just was like, well, will you just take over my thyroid too? Because I don't have anybody, the endocrinologist, there's not many around in our area, at least. I know that we definitely lack that. And he was willing, though, again, to treat it differently than your typical endocrinologist. So he's never, we don't treat the number, we're treating the person. So, if you're saying that you still feel fatigue, run down, whatever, and maybe your TSH is within the normal range, that was one thing with him. I mean, he wouldn't even he wouldn't even bat an eye at my TSH being like 0.01, and he's like, well, how do you feel? I'm like, great. He's like, okay, keep taking the dose that you're on. But I was always on more of that combination, the Armour thyroid that has both the T3 and the T4 in it. So just that combination helps a little bit more. And then going a little bit further and making sure that you're just not checking the TSH, we're checking the T3, T4, and all of the rest. And then, of course, the main thing too that he helped me out with was the adrenals. So coming in then and supporting the adrenals after the fact, or while I'm being treated with all the other stuff as well, that significantly changed things for me. So all of that in combination, again, it's not just one system that we're dealing with a whole body. So the adrenals for sure. Yeah. And then I take oxytocin now too, so
Yeah.
of course, why not try it, right? I mean, we have to talk about it, so it's better to try it.
How much does the oxytocin?
The oxytocin, so my prescription I think was like 120 or something.
No, there are 40 units, and they usually they're scored, and so I tell most people take 20 twice a day, and do that for a week or 10 days, and then double it up, most people within a month, if they don't feel anything, I said, just quit it. Turns out interesting, and you go on this doctor that gave that lecture, that he said that oxytocin, taking it does not suppress your own production. If at all, it encourages your own production. So that's, yeah. Does that answer your thyroid question there?
It did. I think I feel fine.
Yeah.
But, I do. I don't think there's anything, I think I'm fine. But then that really makes me wonder. I'm like, I could feel better.
Yeah.
Yeah, am I right? Do I really need all this? Do you know what I mean?
Yeah.
Like that's where I'm at.
Yeah.
With
Well, I never argue with people who are feeling fine. I'm not, the key, the goal is to make you feel as good as you can. Right. I do know that there are people often, they say, well, I'm okay. When I hear my son, who's a cop, and I say, well, how are you doing? I'm okay, Dad. Well, he's not okay. So I keep at him, and he's always willing to do whatever I suggest.
Hot flashes are they've
Yeah.
gotten less over the years, for sure. They've reduced, but my diet seems to really affect it.
Yeah.
Like if I have red wine and maybe a piece of chocolate.
Sugar.
I'm almost 100%, I'm going to be up.
Yeah.
To be hot flashing.
Yeah, that's why. You might find that if you would do estrogen, that you probably might not get that when you do it.
Right.
But on the other, you can also decide not to do these things all the time.
Correct.
If I eat bread and have a glass of wine, the next morning I'm just like, I feel old. Yeah.
Or a lot of carbs in wine.
And so do I never do that? I do that maybe once a week. Because if I would do this every day, I'd feel like an old man. And I don't like to. But, there are always things you have to kind of, but if I would feel terrible, then I wouldn't do it. You know, because some people do. They find out they have certain issues with foods. I do a lot of food sensitivity testing, and they cut their food out, and all these things get better. Sugar is a huge thing too.
It really is.
You know, the average American eats 30 to 40 teaspoons of sugar every day. Well, you know, when you get a bottle of Snapple iced tea, that has 14 teaspoons of sugar. You know, I used to go, before I would go to work, I always stop at Wawa, get a cup of coffee. You know, but now I make my own organic coffee. By the way, coffee is one of the highest paid crops, so it pays to buy organic coffee. So, but I would go to Wawa at 6 in the morning, and there were these working guys, you know, in their vans. And they'd walk into Wawa and get a half a gallon of Wawa iced tea and a tasty cake. That's what they get. You know, probably by noon this is gone. You know how many teaspoons are in a half a gallon of Wawa iced tea? 48 teaspoons. That's a half a pound of sugar. You know, and you would never put something like that in. But, you know, that is huge. You know, and our kids are drinking this stuff. And, you know, no wonder we have all these problems with our children. I mean, it's multiple. The chemicals, the toxins you were talking about, you know, the too much sugar, bad food, lack of movement, and then, of course, the social media. You know, there's such a huge amount of anxiety. I see more and more high school and college students. You know, and I have, sometimes when I have do patients with a college student, and I say, does any of your friends feel good? And then they quiet for me. It's like, not really. I mean, when I was in college, do you remember when you were in college? I mean, you just felt okay. Doesn't it make sense? It's like, I mean, well, maybe a sickly person for some particular reason, but it's amazing, you know, and it's really worrisome. You know, it's very worrisome.
It takes away from sleep too.
Hmm?
They're not sleeping like we would sleep.
Yeah, well, they on these, you know, their day, that's right, their day-night rhythms are disturbed, and then also just the content, the brain gets overwhelmed with all this random content. You know, my son, by the way, that's more for kids. You know, my son said, you know, he deals, you know, there's pornography and child pornography around everywhere. And he said they said that 50% of boys that have a phone get exposed to pornography. So you need to be on that, you know. You be a pain, but be a pain.
Right.
You know, ideally you like to not have kids a phone until they're like 15 or 16. But you know, it's difficult. You know, now we're getting slowly where many schools not allow them in school anymore. I mean, it's just this constant random information, and they, you know, they don't have any discernments of what could be useful.
Right.
You know, you don't anymore. You know, and, I go always at lunchtime. I always drive to the local Panera, and I just get a cup of coffee just to be out of the office. And a month or two ago, I walked in. It must have been a school day off, and there were 7 teenage boys were sitting around the table, and they were all either on a phone or an iPad. And the only interaction that I saw between one and the other, that one was leaning over the table and looking at an iPad. I mean, that is sad.
Yeah.
You know, and we think this is all okay. It's not okay. You know, they're now...
They play games and the interaction is actually through the computer.
Yeah.
And they're sitting right there.
That's right. But, you know, and you know, and we can say, well, oh, wow, those young people, but, you know, there is a responsibility. I mean, that is one of the reasons why I want to work, and I'm 66, I want to work another 10 years. They're going to need doctors like me.
Yeah.
You know, they need that.
Yeah.
And we need to educate parents and children to help to take care of themselves. You know, because what the medical system has done over the last 80, 90 years, it made people incompetent
Right.
to have a sense about their own health. Because now you go to the doctor and he finds a little blood pressure and your cholesterol is high, so you get a blood pressure man and you get the feeling like you're taking care of your health. Well, you're not doing anything for your health. You know, and in that system, there is no room. I understand. I mean, people don't want to hear talking about diet and movement and their mental. I get it. You know, and so I'm really blessed to, you know, because there is an element. The moment you are willing to pay money to come and see us, you're motivated. So I'm lucky that way. I see all the motivated people. Now I have to judge how motivated they are, and that's with each person. But it's, the average doctor, they're on, they have to see so many people, they get a watch. I think these electronic medical systems are terrible.
Yes.
I mean, I have one, it's handy, I don't fiddle with charts and I can have the labs coming in. But the problem is, the doctors get watched all the time by computers. It's not like somebody, and the moment you write a drug off label that's not fitting with the diagnosis, it just, they can check all of that. And doctors, just young doctors, they just don't want to be spoken to. Just the idea that somebody might make a comment stops you right in the track.
Right.
And it's sad. I mean, it's really sad. I remember in the 90s, it was very clear from the statistics, that people in their 70s and their 80s, the higher their cholesterol, the longer they live. That's complete. It's gone. I see people, they're 70 or 75, and the doctors, I came and my number was high. I need to take a statin.
No.
Well, why is that? But it's lost. It's knowledge. The doctors, they think really they're doing the best thing for their patient. So I always, I tell people, what the real statistics are about that, because it's really not that beneficial at all. It's almost not worth it. But everybody's obsessed about their number. And when
They're walking with a cane because they can't tolerate the statin.
That's-
And they don't put two and two together.
That's right, yeah. And when people are concerned, I always do it as a scan called a cardiac calcium score test. It costs $130. And if you have really a high calcium score, it's like, well, wow, what can we do? But like my score 5 years ago was 0. So I'm not going to die of blocked arteries. When by age 60, I haven't done anything, and I don't do weird things. Why would that happen? So I just don't worry about it. But the problem is that people are worried about their number, and it keeps their attention. While in the meantime, they're eating bad stuff.
That's right, yeah.
While and their mental attitude. Emotional issues are way, way more important for heart disease.
Yes.
It's very interesting. So whatever. I'm getting on a little rant here,
We call that a tangent.
Huh?
You're on a tangent.
That's why, yeah.
But doctors will shame you over that. Doctors will shame you over that cholesterol and not taking the statin.
That's why you get shamed.
Yeah. And it's-
That's why you get treated like a little child.
I said, well,
You know?
I live 2 more weeks by taking that all my life. No thanks.
I was listening to this British cardiologist, and he goes because he said an average adult that doesn't have had severe heart disease has to take a statin for 5 years to live 1.5 days longer. That's when you take the, and he said, I never tell people not to do it. I just show them the statistics. I let them make the decision. Does that make sense?
Yeah.
Well, and most people, why would I take that? But the problem is that even if I tell them and they go home or go to their doctor and they say, oh no, you got to do it. So you're in between, you're caught in between. So I think that when you want to really be healthy, you have to be willing to take responsibility.
That's right.
And nothing is 100% risk-free. It just isn't. You have to be willing and say, that is what I'm going to do because that I think is the best thing to do. But it's always work. We were talking earlier. I say, the older I get, the more work it is to just stay where I'm at. And there are probably a lot of things that I do to help me. They're probably not doing anything. It's always, I say the bummer about prevention is that you do all this work for nothing to change. And you really don't know whether you were the one who needs it. Does that make sense? But, I'd say that laughingly, but, we need to make efforts. But when you make efforts the right way, and for yourself, it enhances how you feel about yourself. Does that make sense? It makes you value yourself more. And that is what I find a lot of it, like when I say, well, what do? We're trying to create first an environment in which the body can heal itself.
Right.
Yeah, and that means removing things, and working with things, and some of them are physical things and some of them are mental things. And then you want to get a sense of control, that you learn cause and effect of symptoms. Does that make sense?
Yeah.
That you say, wow, when I eat that, and sometimes you need help in figuring that out,
Right.
because it's all too much. So when like when we do the food sensitivity test and you have 20 of these foods show up, just cut them all out. And it doesn't mean that they're all bad, but then when you feel better, it's like, try this. And then suddenly you find out, well, wow, when I have bread and a glass of wine, I just don't feel that good. Well, you can make your own decision about that, whether that's worth it to you. It's not killing you. Yeah? It doesn't kill me when I wake up in the morning and I feel like, that. But I don't, so I do that once in a while because I'm a Dutchman and I eat my bread and Dutch cheese once in a while, Remember years ago, I get a big baguette and butter and Dutch cheese, and I was eating that, and I said to my wife, I'm in heaven.
Yes.
And she said, and I'm going to be in hell tonight because you're going to snore. And it's yeah.
True.
Good. Any other question? Yeah?
I would like to refer my mom. I talked to her. My mom was diagnosed with an autoimmune disease.
Yes.
But they can't find out which one.
Yes.
And they said it could be hundreds, and they just basically said, so sorry. And
Yeah.
she has all these awful symptoms, and she's
Yes.
suffering through it.
So that diagram earlier that I showed, I have a whole talk about autoimmune disease. Yeah. Now I have to say that there's all these new drugs out,
Yes.
and and for some people they're lifesavers, but the way I see what is an autoimmune disease? Well, an autoimmune disease means your immune system is attacking yourself. Yeah? It's not supposed to do that, but it does. So I call that freaking out. Yeah?
Yes.
Like I use always the example, say when my son was a teenager and I have a bad day at work and traffic is bad and I come home and he says one word and I throw him against the wall. Well, that's inappropriate. It's also not in my nature to do that. Yeah, but why would I do this? Because I'm up to here. Does that make sense? And so the question is, when people have autoimmune disease or like Hashimoto's, where the immune system is attacking your own thyroid. Well, why is it doing that? Well, usually because it's up to here. And I've had people that were diagnosed with some autoimmune, and some of them had underlying Lyme disease. And they have yeast in the gut and food allergies and their hormone. Almost all people with autoimmune disease have weak adrenal gland. Invariable. I do saliva and low. So what you do when a person to me comes that way, I just start asking them a lot of questions, and then we do targeted tests. And then we start working with that. The problem is sometimes that you may have a real hard time getting your mother in my office.
No.
No? Okay. Because you have to be able somehow to wrap your head around that.
She went all the way to John Hopkins. She sent to so many specialists, but no one can give her an answer other than, sorry, you don't feel good.
Yeah, and I might not put a name on it because you could write a whole page on that thing. I have this whole list of anywhere from the brain and the eye and all these various autoimmune
They
disorders.
just keep giving her eye drops after eye drops after eye drops, but the real
Yeah.
issue is an autoimmune disorder of
Yeah.
some sort.
So, in one way, when you start working with the body this way, I don't really care what diagnosis you have. The only thing that I don't take on fully is cancer. I do some supportive treatments for people with cancer. But it's a serious issue, and you got to be very comprehensive if you want to do things alternatively. But I never say don't do the regular. Because, we don't have an answer for this, so you don't want to be naive. I've seen over the years a number of women, they had a lump in their breast with cancer, and they were like, anything, I don't want to be cut, burned, or whatever, poisoned. And they were, and I say, go get the darn thing out and then do and they did, and almost all of them over the years end up with ulcerating and then die from it. Does that make sense? I'm not against regular medicine, But you know, when they say, oh, you shouldn't take vitamins, or you shouldn't do that, or diet makes no difference, I mean, duh. Does that make sense? And so in that sense, I said, well, I can tell you what I would do supportively, and go to, if you want to do really serious alternative, go to, you know, somebody in Arizona or in Mexico, because there's some very good clinics there. And then if you need to do things that I can do to support you afterwards, I'll do that. Does that make sense? But otherwise, with all other diseases, I mean, children with all kind of things, and you know, lately, actually, that is one thing. Also, a fascinating thing that I started doing is microcurrent treatment of the brain. It's unbelievable, you know, where many, you know, our limbic systems are all tied up. I mean, kids are anxious, depressed, they can't sleep, people have PTSD, you know, and the treatments are trying to suppress them or tone them down. Drugs, herbs, cognitive behavioral therapy, and not that they help, but in the end, the brain is doing the wrong thing. And the question is, how can you do the brain do the right thing? And I mean, this thing is amazing. It takes like 4 minutes. I mean, you might have 10 of them. Unbelievable. And I think it's a huge missing link in a lot of chronic illness. So whatever, that's